Although dandruff is not really a life-threatening condition, but it can really impact on quality of life, and we are going to talk about that today. I'm Dr. Mazhar. Do subscribe to our channel, click the notification bell so that you're updated with our newest videos. If you have suggestions for videos we should make, do let us know and we'll look into it. Today we are going to talk about dandruff. Common causes for dandruff are multiple, and a common misconception is that using shampoo too frequently can cause dandruff, but it's actually the opposite. If you wash your hair or scalp too infrequently, it can actually cause dandruff. Fungal infections, oily and irritated skin, reaction to or sensitivity to hair products can cause dandruff. We talk about contact dermatitis. A number of skin conditions such as psoriasis and eczema can also cause dandruff. It's more common in young adults, and it can be seen up to middle age, and it can also be seen beyond that, but it's not really common. Lack of zinc, lack of B vitamins can cause dandruff. Males seem to be more prone to get dandruff, and this is one reason that we suspect there could be some hormonal factors involved in this. Parkinson, immune suppression, HIV are also conditions that can cause more dandruff. It's important to remember that stress can trigger dandruff also. If you are not really rested, your body is not in balance, if you're physically, psychologically exhausted, mentally exhausted, it can impact on dandruff also. So, and the symptoms are scales and flakes from the skin, hair-bearing skin, especially in the scalp. It could be eyebrows, beard, mustache, shoulders. It can also be other parts of the body where there's hair. We see scales and flakes, and in some patients itching. It's usually a clinical diagnosis, and in most cases, mild cases, we may be able to control it with more frequent shampooing, washing the hair maybe on a daily basis, and using a gentle mild shampoo could be enough. In more moderate to severe cases, we may need to use medicated dandruff shampoos. And there are a number of those that can be used. The active substance can vary from shampoo to shampoo. Zinc pyrithione can reduce dandruff. It has an antibacterial and antifungal effect. And we got a number of shampoos that contains this active substance. Coal tar is antifungal, and it can slow down the skin cell turnover and reduce flaking. It can cause discoloration of light colored hair, and it can also cause discoloration of the scalp. And the scalp can become more sensitive to UV light, to sunlight, and we need to take that into consideration if this is something we want to try out. Salicylic acid can reduce scales, and there are a number of commercial products available. Selenium sulfide, it reduces scales, it's antifungal, and it's important that you follow the direction and rinse well after use. And as coal tar, it can also discolor the scalp and the hair. Ketoconazole is an antifungal medication. It's available over the counter, or it can also be used as a prescription shampoo. The trade name is Nizoral. It can be available. It's available in 1% and 2%. It's important when you use these shampoos that you follow the directions. Then some are applied just like normal shampoos, and some you might need to leave in, and some you might need to make sure you rinse off within a given time. So it's important you follow the direction. You have to try your way through these. Some people may find one shampoo to be really good, and some may say the other one is actually much better. So if you have a friend, your partner has good effect from one shampoo, it doesn't mean that you will have the equally same response from using that. You might need another one. If you experience some good control with a certain shampoo, it could be after some time, after a while, the effects wear off, and then you might need to alternate between 2 shampoos and see how it works like that. In the beginning, you might need it quite frequently. You might need to wash your hair daily, and you might need to then taper it down slowly, and once the situation is controlled and you are at the maintenance, it could also be you can alternate between your medicated shampoo and your normal shampoo. It depends on the condition, the severity of the condition. In some cases, it could be a good idea to see the doctor actually. If you have more signs of infections, we might want to see it, and we might want to have a look and see if we want to suggest something particular for you. If you have redness or tenderness of it, if you see swelling, you should see a doctor. If the scalp is very itchy and it's more bothersome, it could be a sign of an infection going on. It could be eczema, it could be psoriasis. It could also be a fungal infection with a ringworm or skin conditions, and we'd need a doctor to be involved. If you try out the medicated shampoos and they're not really working, they're not effective, then we would need to see you, and we might need to go into some prescription level shampoos, or we might even consider steroid treatment depending on your condition. There are some misconceptions about what causes dandruff, and as I mentioned in the very beginning, some people may think that using shampoo too frequently can be a cause of dandruff. It's really not. There would be very few cases, and it would not be the frequency. It could be if you have, for certain hair products, your skin is sensitive or you develop contact dermatitis, that could cause you to have dandruff. But normally shampooing will not cause dandruff. Hair dyes and conditioners do not really cause dandruff, so you can use them if you don't have any other issues. We don't expect that to be the reason for your dandruff. So this concludes our video on dandruff. Do let us know if you want us to make a video on a certain subject. You can subscribe to this channel, click the notification bell, and let us know if you want us to make any certain videos. You're also welcome to share this video with your friends and family so that they are updated about dandruff treatment and diagnosis. Thank you.